Hi, everyone. This is Richard Troncali. I am the social media coordinator and your host for our latest STEM Talks on the health tech revolution, how technology is reinventing healthcare. Thank you all for joining us today. We have three participants who are joining us tonight. First one we have is Dr. Susan Lefrancois. She is our assistant professor of health informatics at Florida Poly. We have Dr. Robert Steele, who will be joining us in December, and he is our director of the Health Informatics Institute. And lastly, we have Elizabeth Kearns, who is the Senior VP and Chief Information Officer at the Lakeland Regional Medical Center. So thank you all for joining us tonight, and we are excited to kick this off. So the first thing we really want to talk about, first we want to dive into introducing our panelists. So Dr. Lefrancois, if you can just introduce yourself for a couple of minutes, that would be awesome.
Awesome. Okay. Hi, guys. That's me. So I am currently assistant professor in health informatics at Florida Polytechnic. I used to be the director of quality and regulatory at a medical device sterilizer. And I worked with the FDA and other medical device companies. So I have a little bit of industry background and a little bit of academic background in health informatics.
Well, thank you for joining us. And Dr. Steele?
Thank you, Richard. So as Richard mentioned, I'll be joining as the director of the Health Informatics Institute in December, which is a very exciting role. I've had experience as a division director of health informatics, head of discipline of health informatics, and as a deputy dean of research in a school of engineering and technology also. So I guess myself with collaborators have published around 120 peer-reviewed articles and have been engaged with a lot of active participation with industry partners. So it's really the field of health informatics is really a very ripe one for research and industry collaboration at this time. So thank you.
Absolutely. Thank you. And Elizabeth Kearns?
Thank you, Richard. And thank you so much for inviting me to participate on this panel about healthcare informatics. This industry is on really a major curve of healthcare technology innovation, and I'm delighted to participate this evening. I am, as Richard said, the Senior Vice President and Chief Information Officer at Lakeland Regional Health, which is a community nonprofit hospital. We have 851 beds, so a very large hospital, and a network of ambulatory clinics. I've been in the IT field for about 30 years, most of it in social business, and for the last 9 years, I've been in healthcare. Just a very exciting journey that we're on, and look forward to this evening sharing a little bit about our journey at Lakeland Regional Health with information technology.
Thank you all for taking your time tonight to join us for our STEM Talks on Health Tech Revolution. And so just for your listeners out there, please feel free to chat with us throughout the whole entire STEM Talks discussion tonight. If you have any questions for our participants, please feel free to share those with us. And so when we talk about health informatics, really what we're looking at right now, there's a bunch of trends going on where we're looking at mobile healthcare, patient privacy, cybersecurity, and more of new trends that's happening in the healthcare world. And the applications can go across several different ones. What we're looking into are physical therapy areas. It can be dentistry. We're looking at pharmacy. And so it's applied across a wide range of industry. And so the burning question that we have, and what we're going to dive into tonight, is how will advanced technology continue to reshape the healthcare industry? And so when we first start this hangout, we want to have Susan, Dr. Lefrancois, talk about the overall how health informatics is evolving due to technology.
Well, that's a great question. And thank you for coming to me first on that one, so I can get all of my answers out and trump everybody else on their answers. So health informatics has actually been around since the late 1960s. And as computers have become more capable of holding lots of data, it's become more useful in fields like healthcare. Things right now that are kind of hot in health informatics include artificial intelligence, using decision support software for physicians in order to give them some more information in order to create a diagnosis to be more successful in their own careers and have patients become more successful. Also, mHealth, so mobile technology in healthcare, using smartphones and other applications. You might have heard of someone you know being prescribed an application by a physician. So these applications can create an environment where the patient is more engaged and having more support by the physician and a community that maybe has the same issue. So this will overall make a patient more educated and probably more successful. That industry in 2017 has projected to be about a $26 billion industry. Smartphones are morphing into medical devices by adding different sensors to a smartphone and combining that with an application. Patients can put in information on their leisure at home, and a physician is then able to access that information and able to provide a better conclusion for the patient. Telemedicine is making specialists more available in rural areas where they might not be able to see certain patients that need them. And then also social media in medicine, podcasts in medicine. It helps market hospitals. It helps make hospitals more transparent by allowing patients to describe their experiences and other potential patients to see their outcomes over social media, which is a very trusted means of expressing information for potential patients.
Awesome. And so you touched on the EHRs, electronic health records. And so if you can just elaborate more on that and how right now, basically, we're going from a paper environment to the EHRs. So if you can just discuss that transition for us.
Sure. So electronic health records are EHRs, and electronic health records are something that you probably have experience with. If you ever gone to the doctor, you might not actually see your doctor's eyes. They might be focused on a computer screen, and on that computer screen are fields that the physician has to fill in order to make your data available to not just him, but other physicians in the health system or other specialists or to some auxiliary services to the physician, such as a pharmacy or radiologist or any other specialist. So the electronic health record has been adopted by a majority of hospitals, and its intention is to create interoperability where other physicians and other services can communicate and have information about you or wherever you might be located.
Fantastic. Thank you for answering that one. And the thing that excites me the most is that a couple of weeks ago, I went to the dentist and they had to fax over my information to another dentist, which was pretty frustrating. So it's nice to hear that we're going to have an EHR where everything's just seconds away. And so Elizabeth Kearns, if you could, can you explain to us how the Lakeland Regional Medical Center is transitioning to an EHR?
Oh, sure. Let me back up just a little bit, though, first and explain why this transformation is really happening in the healthcare industry. And it really was spurred on by the 2009 and 2010 healthcare reform at the federal level, primarily for two reasons, if I'm oversimplifying things. One is the escalating costs of U.S. healthcare. Approaching 20% of the gross domestic product, multiple millions of dollars on a steep growth curve, and an absolutely unsustainable model of healthcare costs. And the other, I guess, a dramatic thing happening in the United States in the healthcare business is the growth of the chronic diseases, obesity, diabetes, chronic heart failure, just hypertension, lots of different chronic diseases just exploding out of control. And the government noticed that this is not a sustainable model, and implemented the healthcare reform. And part of that reform says that every hospital in America had to go electronic records, no more paper. And part of the reason why we need to get off of paper is because of the errors and the non-transparent manner in which healthcare is delivered by paper. In our hospital, for instance, when we had paper charts, it's sometimes difficult to find the chart to share among the various caregivers. Paper charts are also known to have illegible handwriting in them. Medical errors are more prevalent, particularly around medication, not being drug interactions, allergies, either food or medication allergies. And so we knew very well that this was absolutely the right thing to do. It is still a very difficult thing to do, especially for nonprofit community hospitals like ours is. It's a very complex implementation, electronic health records, also very, very expensive. We undertook this journey. We started in, we had various components of health information technology for a number of years leading up to about 2011. 2011 is when we started on a 14-month journey to get off of paper charts in the hospital at large and go to electronic health records. We are fully electronic now, using one of the market leaders in electronic health records, and our success was driven simply because we had wonderful collaboration among all of the stakeholders in our hospital. This thing took collaboration with physicians, nurses, IT, informatics personnel, finance, just a little bit of everybody. So a very, very complex journey.
That is awesome. And so we actually have a question that just came in, and I wanted to tie this back into EHRs. Recently, I don't know if you guys, I'm sure you've heard about this, but there's been some companies out there that have had cybersecurity attacks resulting in $100 million lawsuits against them. And it's pretty scary out there. So with the transition from an EHR, how are we going to protect that information? So the question that we have coming from Twitter: what is the most frequent type of data breach suffered by consumers, and how do you correct it?
Is that? Go ahead, Dr. Steele.
We can both give an answer to that, but one interesting observation has been that health records are considered the most valuable piece of personal data in comparison with other traditionally hacked items such as credit card numbers or social security numbers. So their value per record is on the market of about $50, but there's a lot of per record. Obviously, the cost to an individual could be far greater if their privacy was breached. But there's a lot of mechanisms that can be employed to address these cybersecurity issues as well. Various best practices. One of the key concepts is that it's very hard to set up a non-porous wall for your organization, your health organization now, and basically that means that there can be attacks penetrate some sort of outer wall, and the question is how to stop data loss from there or any adverse effects. So there's such topics as intrusion detection, also stopping of exfiltration, and really very much about education of the personnel within the health organization. A lot of these, when you talk about these highly publicized security breaches and privacy breaches, they're often a result of phishing attacks or malware attacks. Okay, and these really require not just the IT security department to be well educated, but all users to be able to recognize phishing attacks, be able to recognize possible malware threats, and to handle those appropriately. But there's other system-wide things that you can do as well. And actually, interestingly, analytics plays a role in that as well. So traditionally, it was kind of what you call signature-based prevention, where you look for previously recognized viruses or malware, hence antivirus signature sets. But there are a lot of attacks now that have not been seen before, and what that requires is analytics approaches to essentially do intrusion detection. So there's a whole plethora of techniques, human-related and technical-related, to help prevent that.
And then Elizabeth Kearns, I know you wanted to answer something also. So,
as Dr. Steele correctly pointed out, protecting health information is a multifaceted job, and it takes both IT security tools, a well-architected network with firewalls and intrusion and penetration detection logs. We actually have a staff of IT security folks whose only job is to ensure that our network is constantly shored up and that we move forward as tools advance. But the other part of it is the education of the staff. And we do spend a considerable amount of time and energy and resources making sure that our staff understand HIPAA rules, which is Health Information Protection and Privacy Act. As you may have known by the news reports, there are a lot of hackers that are focusing very, very much on the healthcare industry now with especially these ransomware attacks. There have been a couple of hospitals that have been hit by these ransomware attacks and have had to actually pay the ransom to get their data back. So it's very serious business, whereas the recent number of years, the hackers have focused on the financial industry and stealing credit cards and things like that. Attention has turned very much to the healthcare industry and people trying to steal identities and particularly insurance information so that they can defraud insurance companies. So we do spend a considerable amount of time and investment on security tools and security education.
And Richard, could I just add one thing into that conversation? I just wanted to add, I feel hospitals are given so many responsibilities, and their responsibilities are growing every day. You look at Health IT News, and this is one of the areas that I feel the hospitals should have some help from medical device industries, for instance. So I believe other industries that contribute to a hospital should carry some of the responsibility of securing patient information and be more cognizant of that when they create their designs, and more knowledgeable about the infrastructure of the hospital and how their devices will work inside the hospital environment to protect patient information.
Absolutely. And I actually seen a number a couple of weeks ago where they were suggesting that for 2016, about $6.5 billion will be spent on the healthcare industry and technology, which is a large number. And so going from that one, we want to talk about in health informatics, what trends will we see within the next 5 years? And we want to throw this one over to Elizabeth Kearns.
I think we're going to see a continuation of the data explosion. The electronic health record has given us the just a wonderful mass of data, and a lot of it is in structured format. We can now use this data to do all sorts of great things. We can do trends and patterns in data to find perhaps pockets of areas where we want to focus our population health initiatives, community health initiatives. Perhaps we could find areas where we have an abundance of diabetes or obesity or hypertension, and really focus resources on those areas and those particular populations. I think we're going to also see this continuation of consumerism in healthcare. We're seeing now patients taking charge of their own health and wellness and their own care through all the venues, from ambulatory care into the acute setting, acute hospital setting, and out to post-acute settings like skilled nursing and home health. And patients are educated. There is a wealth of information available to them, databases. I think we talked a little bit about social media, telemedicine. I think the other big area that we're going to see really explode over the next few years is the bidirectional communication between consumers of healthcare, or patients, if you will, and their healthcare providers from all settings.
Awesome. Well, thank you. And did you guys have anything else you wanted to add to that one?
Maybe I think I'd certainly agree with Elizabeth's comments there, and in some ways the deployment of the EHRs is really just the foundation of so much that can be built on top of that. And I mean, sometimes I comment that the introduction of this digitized health data is not a quantitative change; it's a fundamental qualitative change to what you can do. So the sorts of, for example, analytics you can do across that data as a result, and the sorts of visualizations of that data, or the sorts of interactions you can have. It's not just like you've taken the functionality of the old paper-based EHR and and then just got a digital equivalent. It's a lot more than that. There's a whole layer where you bring in data warehouses and build analytics capabilities on top of those. And certainly I also echo Elizabeth's comments on the move towards consumerism, and just throw in again this extra emphasis on the great strides happening in health sensors, those sensors being present in smartphones. Of course, the smartphone wave itself is a mega wave that's changing everything, but it certainly has a lot of impact into health. And you would even see that currently Apple and Google and other the very largest tech companies have quite an emphasis on health at this point. And for example, the latest Apple Watch, for example, has a increased number of health-related sensors, the ability to capture vital signs and other physiological data. This really points to, as those sensors get more powerful and have new capabilities, for example, capturing some sort of blood constituent information, this will really lead to a massive change, even more than what's already happening. And there's a lot happening already, but this sensor revolution is going to really revolutionize things as well.
I'll just add a few more things. Obviously, Dr. Steele and Elizabeth hit on the highlights, but I'll just give you a few that I thought about while they were talking. I think that there probably will be more emphasis, a trend on decision support systems in hospitals in general to help physicians with their decisions with the patient that are about diagnoses and treatment plans, but then also maybe customized treatment plans because of, for instance, the genetic sequencing becoming cheaper over time. This will allow some more customized medicine, some more customized treatment plans for patients that physicians can access. And the other thing I wanted to mention, physicians have been bombarded by technology, and I think they are becoming dependent on technology. And I believe because of the Stanford 25, that physicians might be re-educated on means of treating a patient without the use of technology. in case of a situation where there was downtime, so that the patient isn't so reliant. The physician isn't so reliant on technology that they are incapable of treating a patient when there is for instance, a hacking incident or a downtime that occurs at a hospital.
And could I add a little bit? I
Yeah.
wanted to take off a little bit on a topic that Susan mentioned and give you a real world example of what she means by using this big data to develop treatment protocols and assist physicians in diagnosing. We recently implemented a sepsis crawler in our EHR, and that continuously looks through all of our patient data for patients that are currently in the hospital and watches vital signs, and then detects when there are trends that would indicate a patient might be developing a blood infection or any kind of infection. And this thing has just been unbelievably successful for us. I believe that we have detected patients that are declining, and you don't really know what an outcome would have been without it, but I'd like to think that this kind of technology is really saving lives.
Absolutely. I actually foresee down the road, when a patient goes to the hospital now, they just give them a wearable that will detect all their vital signs instead of having to manually do it, which is interesting. So I want to tie in on that one and talk about, we're talking about wearable technology, cell phones, smartphones changing the industry. And so what are some of the other ways that the health informatics industry is changing right now, other than just the smartphones and wearables? And so, for instance, I know I was talking to Dr. Lefrancois a couple weeks ago about EHRs and how with the struggles of transitioning and getting all that the handwriting onto an actual electronic form, how are we going to adapt to missing information?
Okay, so maybe that's why you avoided me in the hallway, because we had those long conversations with electronic health records. But how are you going to adapt to missing information? I think my answer is going to be the electronic health record companies make customized changes for hospitals. And I think what will happen, there'll be better fields, better interaction with physicians. Over time, as electronic health records are used more and physician feedback is more heard, I think the electronic healthcare records will become something of an extension to the physician and not something where the physician has to deal with it. I think any new technology over time just becomes better because people are more aware of how a physician would use it, are more aware of what fields are most important. And technology will just get better. So if a missing field occurs, there might be something that's determined by electronic health record companies that can help smooth over problems like that with a record. I think that as technology advances and as electronic healthcare records are around longer, there'll just be more customized, better solutions for physicians in general.
Thank you.
Well,
I'm sorry.
The other big trend that's happening is connectivity of biomedical devices into the health record. And so now these machines are sending data directly to the electronic health record. So clinicians don't have to remember to enter, for instance, vital signs every hour. They certainly need to check them, but the machines now forward this information. We have not only physiological monitors connected, but also infusion pumps. So that monitors the administration of medication. We have alerts that come from, for for instance, radiology, when a radiologist reads an x-ray and there is a critical result, those fire alerts right into the EHR for the clinicians to react to. And it even goes to things like the beds now. Those are connected to the EHR in many instances, and clinicians can be alerted to the angle of the bed, whether the patient has exited a bed, just an enormous amount of data points that are coming from all kinds of hospital and biomedical equipment now right into the EHR.
Thank you. We had a question that just came in, and all three of you guys had discussed and mentioned that social media will have an impact on the health IT world. And so if you guys can just get into that and dive a little more deeper into how social media will play a role in healthcare informatics.
Okay, well, I'll just a couple of quick thoughts about that. I mean, in one context, you can use social media as a way to provide peer support between patients with similar experiences, and provide that sort of peer support and peer sharing of knowledge and understanding. Beyond that, another interesting area being explored is there's various companies that set up groups specific to a particular condition. Patients Like Me is one example, but there's many others. And for rare conditions, it provides a way to link that rare, those sufferers of that rare condition to each other, but also to researchers in that field that might not otherwise happen. So, for example, if it was a condition that only occurs in 1 in 10 million people, it would be very hard to ever realize some sort of critical mass of those individuals. But with social media, with a global reach, that's a possibility. And one other idea I'll just throw in there is that the use of social media, particularly things such as microblogging systems for the distribution of public health information. And that's actually an area of one of our areas of research. I think it's quite interesting. Sometimes this can be described as what's called a large-scale cybersocial system. And the interesting aspect of this is that you can actually track and quantify how this public health information is being distributed and who's receiving it. And that's not something that would be the case in traditional public health intervention. So there's an ability to, again, analyze and see who's sharing it and who's receiving it. That in itself is a very fascinating research field and a very fascinating application.
Well, and I will tell you from the healthcare provider point of view, social media is a little bit scary, and especially for a CIO. We have to be very, very cognizant that we are not exposing any personal health information. It is protected by the HIPAA laws. So we have only dipped our big toe into the social media realm, and we are using it very much for sort of marketing, communicating events, education. There's a lot of education information that we put out over our Facebook, for instance. And so at the moment, we're distributing information like that via social media. But as a consumer, I could very well see some of the ideas that Dr. Steele mentioned using social media in finding like folks with the same diseases and conditions to share information with.
I'll just add one other thing. I agree with everything you guys said, and I just wanted to add that social media could be used sort of for advertising. In the past, hospitals have utilized patient stories on social media in order to get attention on maybe a particular disease that's treated at a certain hospital, certain specialists that are available there, and then the patient experience. So it can be used as a way for the community to understand what's available to them at a hospital that's local to them. Also, texting among physicians. I know it's not exactly social media, but that's something in order to kind of bring physicians together quicker under maybe like an application that's secure. That's something that I know it seems like a no-brainer, but because of security issues, communication, still in certain hospitals, they use beepers and pagers to get a hold of physicians. So that type of ability to get a hold of somebody is really, really old and needs to be updated. So tacking on from social media to that texting issue, I think that's an important thing to mention.
Absolutely. Thank you guys for answering that one. Another question that we had, so with this big trend to go towards technology in the healthcare industry, what financial impact does advancing health IT have on patients and also on healthcare providers?
Well, I can tell you from the healthcare provider hospital standpoint, there are both positive and negative impacts financially for us. As I mentioned earlier, electronic health records and transitioning from paper to health records is enormously expensive. It's a huge undertaking, not only in buying the software, the licenses, professional services to implement, but buying all of the hardware. We are an 851 bed hospital, and we have probably about 6,000 computer end devices in our organization. A computer in every hospital room, plus computers on every support person's desk, plus mobile computers for those clinicians who travel, like pharmacists, respiratory therapists, physical therapists, occupational therapists, even food service and chaplains now, transport, linen folks, everybody is computerized now. So it is a huge investment, and it is ongoing. That said, the electronic health record and the technology that's going on in this industry is also really helpful in capturing costs and charges, and being able to have that all automated and have all of that flow into the accounting systems, the financial systems, is really helpful as well.
So in terms of the consumer side or the patient side, I guess what we would expect to see is the same general trend with technology, which is that it keeps getting better functionality, faster and cheaper over the years, and that's what we're seeing in devices in general. So there's reason to be very optimistic about its the value it's providing to patients and consumers in general, and then the mechanism by which that can translate into greater savings is the use of these in a consumer, such devices in a consumer setting, where it leads to early detection, better engagement by the patients, and more proactive in their own healthcare, or even optimization of their healthcare, and thereby saving them the big bills further down the line when they become seriously ill. So certainly, as Elizabeth describes, certainly in the clinical setting, there's huge upfront costs. Interestingly, this technology, when it goes to the consumer, in many cases they purchase these devices through their own volition anyway. If you're talking about smartphones, so many things you may get from healthcare don't really add any extra cost to them. And again, the functionality is always improving. There's a lot of investment going into improved sensors again, and I think that that the big picture that will take a little bit of time to fully materialize is to see that translate into early detection, preventative steps, engagement, things like that.
So I'll just add to what everybody else said. So the reason why health insurance was created in the first place was because the average person couldn't afford it, couldn't afford healthcare. So it became an employer-based system in order for the average person to be able to go to the doctor and get help. So I think that the cost of healthcare as technology advances on the short term will increase. And I think that eventually what will happen with electronic health records interoperability, there might be some hospitals that are local that have certain technology and others that might have different technology, and physicians can send the patient to those different locations if necessary and gather all that information in whatever location they're at. So technology might become more coveted at one hospital, and maybe others might not invest in it if it doesn't work out for them financially.
Well, and just to close out this topic, recall that the reason that healthcare reform is here is because of the exploding costs of providing healthcare to the American public, and the explosion of chronic diseases. So one would hope that this technology is going to drive those costs down and drive down the chronic disease prevalence by just a number of different ways, but for sure we would expect that the computerization of health records would mean less utilization of diagnostic tests, for instance, particularly with the health information exchange that's going on between venues of care. So if I go to my primary care doctor and get an x-ray, and the x-ray determines that I need to get some hospitalized care, when I go to the hospital, if my x-ray weren't available to the hospital, they might do another x-ray there with the same result. So sharing of the records, early detection, all these sorts of things should really, at the end of the day, drive down healthcare costs and make us a healthier population.
And just so I can make one.
Go ahead.
Sorry, Susan. Just one direct follow-up on Elizabeth's comments there. I mean, chronic diseases are accounting for about 85% of the healthcare costs, and chronic diseases are often called lifestyle diseases. So it's not about what happens just in the clinical setting. It's about changes in day to day. So again, this is where consumer devices can play strategically a key role, because they can support behavior changes, greater information to guide the individual in relation to the lifestyle aspects that are really impacting those chronic conditions, which makes up such a large proportion of the overall cost.
Mm-hmm. I think it's such a complicated question because obviously there are so many attempts to reduce the cost, and it's never 100% best answer that's proposed. So insurance companies have tried things like bundled care to allow physicians to choose from a preset package of tests and technology that can be used for a specific diagnosis. And one physician at one facility might have the same procedure as another physician at another facility, but it was over 50% more expensive. So there's still a lot of variability, and technology might add to it, but it's not the only reason for issues in healthcare costs.
And if I might just add one more comment, I've talked, and we've all talked a lot about the cost of healthcare. While that is a driver of healthcare reform, I do believe that the real value of technology in healthcare is so that we have better outcomes. This is really about taking better care of sick people and keeping healthy people healthy. And we focus, particularly in my organization, in shifting our focus while we'll always have acute care in the hospital, we'll always take care of sick people, but we need to focus and turn our attention very greatly to the population health and wellness, well care, keeping people well and keeping people out of the hospital with preventive medicine and proactive care.
One of the things that excites me the most about this transition, especially for a consumer, on a couple weeks ago, I took my dog to the vet, and my vet sent us over the dog X-rays while I was at work, so I didn't have to go to the vet to see the X-ray, and he emailed it to me, so that was pretty cool. So our last question that we have for the night, and it touches on what Elizabeth Kearns just mentioned. So in what health fields do you see the most potential for improvements within health informatics? And how will technology really change those different areas where we're needing improvements?
Well, as I mentioned, there is a huge shift in from the provider perspective in focusing on the pre-acute care, taking care of people in the primary care setting, in the acute setting. And I think that's where we're going to get our big bang, because once somebody is acutely ill and they're in the hospital, those costs skyrocket just very, very quickly. So if we can keep people healthy and keep them out of the hospital, that's where we need to put our efforts and our investment at this time.
So again, I think echoing that is that it's the fields with the greatest health system burden, the chronic conditions, which are the ones which may see the biggest benefits. But I guess the other aspect of that is that you can really see potential benefits across all health disciplines, all health fields, with the sorts of areas we've talked about, such as the use of analytics. So again, you'll have a lot more data to analyze and look at early indicators of increasing severity, categorizing patients at various stages, all sorts of predictive modeling and so forth, that really they can be applied into any area of health where there's going to be data. So the general trend is there's going to be more digitized data, and these are actually, many of these techniques are generic and can be applied with domain expertise, but can be applied into different subparts of health. So you could see it positively affecting many or most specific health fields.
So I'll sum it up, end it for this question. I think that health informatics is such a young field, and there's so many new things that have just started to be utilized in the healthcare industry that probably every aspect of healthcare could see improvement in health informatics and better utilization of the data that's being collected. But one thing that I was thinking about, it would be great if a physician could have the analytics tools easily available to them in order to draw their own conclusions about data that they collect on a specific patient. So not only are the physicians receiving data from the patient when they come to visit, but with all the smartphone technology and these wearable devices, they're being bombarded by patient data. So in order to manage all of these sources of information for a specific patient, in order to get value from all this data, it would be great to see a physician be able to have some sort of analytics tool that could help them make sense of all the information.
How about IBM Watson?
That would be great.
I read an article recently about the Watson computer. Having gone to medical school, they partnered up with Cleveland Clinic, which is a very renowned organization, to start doing just exactly what you're talking about, is really provide some intelligence behind data at the time and place of care. So right at the physician's fingertips, data would be analyzed by this computer. and some intelligence provided to the computer. But that article said that healthcare data doubles every 24 months. The amount of healthcare data that we have in volume doubles every 24 months. And I suspect that that is an escalating number. So it's unbelievable what we're going to have available to us.
I was reading something in the news a couple of days ago, and IBM had announced that they have a new nano chip that will detect symptoms for cancer or any illness even before a symptom ever was to occur, which is pretty interesting and cool to see. And so I want to thank you guys for joining us tonight. And again, thank you to our listeners for joining and listening to our STEM Talks. And we appreciate Dr. Steele, Dr. Lefrancois, and Elizabeth Kearns for joining us on our STEM Talks. Our upcoming one will be on the Internet of Things, and stay tuned. We will announce a date for that coming shortly. Thank you all again, and have a great night.